Hello, future occupational therapists. In Module 2, we are looking at chapters 21 and 22 from Willard and Spackman, which are all about how OTs use analysis. You had previous exposure to chapter 21 in your other class, so there are just a few points to touch on there before moving on. So let's get started, because I promised you I wouldn't keep you long. Oh my goodness, so many different types of analysis. I was overwhelmed by all these different types. And I know what I'm doing, so I can only imagine how challenging it is for you to try to make sense of all this. But let's give it a try. So far, you've been focused on activity analysis, examining the hypothetical and typical ways a specific activity would be done. You've often had to make choices from multiple options of how something could be done. Like last week, many of you noted that some of the board games you examined could be played on either a table or a floor. Remember when we talked about the different types of clinical reasoning, and that when you first see a therapy referral with a name, age, and diagnosis, you use scientific and procedural reasoning to start thinking about what you know about this diagnosis, people this age, etc. And it isn't until you actually get face to face with the person that you can start moving on to more specific types of clinical reasoning, like narrative reasoning and interactive reasoning, to refine what you need to do to assess and treat this specific individual. Occupational analysis compared to activity analysis is like that. It's like the activity analysis is the scientific and procedural reasoning process, and the occupational analysis is more of that advanced narrative interactive reasoning. So with occupational analysis, now we're going to look at the specific individual and the specific way that they do that activity. But we already know that occupation is really complex, so to fully analyze it, we need to look at it from a variety of ways. So we combine what we know about the activity analysis for that occupation with a performance analysis of this specific person doing the task, and then we look at where they struggled and we do a task analysis. What is it about that task when combined with this person that made them struggle, and how can I address it? So you might be asking yourself a few questions. If it's really all about occupational analysis, why did we need to learn activity analysis? Because both occupational and activity analysis are required for effective practice, but it was easier for you to start with the activity as you were learning the language of OT. Ultimately, activity analysis is actually going to come into play further down in the treatment process. OTs need to know how to analyze activities for two main reasons: to select activities that are occupationally meaningful to my client, and to know how to use those occupations to meet client goals. When my client needs to work on a specific skill, such as increasing their shoulder range of motion, I can use my activity analysis skills to compare many options of occupations that require shoulder range of motion and select an occupation that's most meaningful to my client. You might also ask yourself, will I see activity analysis in practice? Maybe and maybe not. Right now, you are learning to do this. When you're learning, you have to approach things in a systematic and ordered way to be sure you don't miss anything. The goal is for activity analysis to become an automatic thought process. Experienced clinicians don't need to write out all the steps or even think through a task with specific terms in mind, like asking themselves, what are the properties of this object? They can consider a variety of tasks and think through them behind the scenes as they're processing all the information they're getting from the client. Because it becomes such an automatic process, you may not see it when you're doing your fieldwork, unless your fieldwork educator is really good at verbalizing their clinical reasoning process and can explain to you how they got to what they're doing in that moment. But experienced clinicians do sometimes need to approach it in the same methodical way that you are now, especially when they have little familiarity with an occupational task that a client needs to perform. For example, I was treating a gentleman who had a traumatic brain injury, and he had owned his own construction business. As part of our therapy sessions, we set goals related to him doing basic construction tasks on his unfinished barn. High-level things like installing electrical outlets. Before I could analyze his occupational performance to know if he was doing the task safely and accurately, I had to do an activity analysis so that I knew all the required steps of installing an electrical outlet, it was a task that I had never done before. Let's use the activity of bouncing a large ball back and forth between two people to understand the different types of analysis. An activity analysis, or thinking abstractly about what the task requires, might look something like this. Once I've done an activity analysis, I have a basis for considering the activity of bouncing a ball for possible use in intervention, and I have options for modification of the task if needed. We'll circle back to this in a minute. Performance analysis would involve describing how a specific individual does a task, with the purpose of being able to document their current baseline or their starting point and establishing goals for treatment. We do this by breaking down the specific performance skills, or the smallest units of performance that we can see, as they go about the task. While they will obviously use their body, performance skills are different than body functions. Here we're concerned with what a person does as they interact with task objects, not just how the body systems function. Your book, as well as the Occupational Therapy Practice Framework, provide universal or commonly accepted lists of motor skills, process skills, and social interaction skills. And these are some of the things that you're going to be including on your documentation form that you're creating as part of your homework this week. By the way, on page 259, step 2 gives you some good hints for things you might want to incorporate into your form. So these motor, process, and social interaction skills are the performance skills that we're going to start with. But there are also task-specific skills that we could use. For example, if I were analyzing someone accessing a computer, I might talk about the ability to activate keys on the keyboard or alternate their vision back and forth between the keyboard and the monitor. Let's go back to our previous example. Now, as part of my evaluation of a 7-year-old girl's occupational performance, I ask her to play a game that involves bouncing a large ball back and forth with me. This is the type of information the performance analysis would look like, with terms from the universal performance lists bolded. Then we have task analysis, in addition to activity analysis and performance analysis. In task analysis, we ask ourselves, why is this person's performance quality like this? We think about the person factors, body functions, contextual, environmental, and social cultural influences that might be involved. This helps us think about what problems could be addressed by occupational therapy and what interventions would be most effective. Let's assume the girl I evaluated had difficulty performing the task of bouncing the ball. With task analysis, I begin to think about why. There's a variety of factors. Any of these could be the factors, and individually or jointly, they could be impacting her performance. This allows me to start thinking about factors I may need to evaluate further, and what issues I need to address, and the types of interventions I might consider. Remember the activity analysis of the bouncing ball we did earlier? Now, if we also consider the body functions needed, I can match this up with the current skills of the little girl. So now I can think about which skills I need to address in order for her to be able to catch the ball, or I can think about how I can modify the task to allow her to be successful with her current level of skill. Finally, the concept of occupational orchestration was discussed. With occupational analysis, we looked at one occupation in a variety of ways. Occupational orchestration means that to really understand an individual's ability to perform, we have to look beyond this one task and look at how it fits in with everything else they do throughout the day. Uh-oh, sounds like we might have a lot more analysis to do. But we've got plenty of time. 14 more weeks to be exact. So this week we will just focus on working as a group to analyze the occupational performance of Mrs. Torres and Dr. T. The end.